When doctors and patients have heard about melanoma in the past, this has always been one of the scariest diagnoses that we've had to deal with. And what has been remarkable over the last several years is that the approach to melanoma in the advanced setting has changed the way patient outcomes might be, but has also changed the way we look at other cancers. Melanoma has really led the way to all of the things that you've heard recently about immunotherapy and precision medicine and all of these terms that patients hear about. That all started with a very, very, very sad and dark history of patients with advanced melanoma. So in the old days, if a patient had melanoma that had spread to other organs, we had a few options. Chemotherapy didn't work very well. We had some immunotherapies that were crude and would help a very small percentage of patients. But over the last years, we've understood better the pathways that can lead to melanoma. And we actually have some very specific treatments that inhibit some of those pathways that we see in melanoma. But we also understood that our immune system played a big role in trying to combat melanoma. And we've been able to harness the immune system to make that better. And these are those immunotherapies. So it's interesting. Precision medicine is focused on a very single mutation that might be driving a cancer. And many melanomas have what we call a BRAF mutation. And we have very good medicines now that target that. Immunotherapy looks at a different way. Instead of looking at one area, let's bring the immune system in to attack the cancer wherever it may be. And that's translatable to cancers that might have different mutations, so they don't all have to have the same. All of the breakthroughs that we hear about in immunotherapy and precision medicine, a lot of those started with melanoma. What I think is really important about the discussion of melanoma is how do we get to the point where fewer and fewer patients have to deal with melanoma that's spread to the liver or to the bone or to the lungs or to the brain? And how do we nip it in the bud before that ever happens? One, we always talk about prevention. We talk about sun avoidance, especially during high UV light periods of time, using sunscreen, sun protective clothing, and so forth. And I think it's really important that we pay attention to children, all right, so that we watch our kids and their sun exposure and so forth. It doesn't mean that we have to live in a protective bubble, but be sun aware. The idea that if we've got our kids in sports and they're out in the middle of the day, they really do need sunscreen. They really need to be protected. Because if we can prevent those sunburns and those high sun exposure times, we may be able to prevent melanoma altogether. And secondly, understand that we live in a world and a culture that is an outside world and culture. And some of us have gotten sun exposure over the years, and that we should pay close attention with our primary care physicians and some of us to dermatologists to where we're getting a good skin check once or twice a year, more often depending on our history. If we have a family history of dysplastic nevi, which is an abnormal mole that's not melanoma, but increases our risk of developing melanoma. If we have melanoma in our family, that we pay attention to getting those screening things done. It is beautiful, the science of how we treat advanced cancer, but it would be much more beautiful if we didn't have to deal with advanced cancer. And I think that's the story of melanoma. Early detection, which we can all do, prevention, which we should do better and can do better, and then, God forbid, if we have to treat advanced disease, these newer tools that are remarkably useful for patients.